Welcome to Myo360, the podcast, where we'll delve into all topics related to myofunctional therapy, including airway health, snoring, TMJ, tongue ties, thumb sucking, and even bedwetting. As a myofunctional therapist and a formal dental hygienist, I am sharing stories and tips to help you identify if myofunctional therapy is right for you and how it works to improve your overall health. Join us while we explore the ever-growing world of myofunctional therapy. We have one goal in mind: to help you and your family live your best life.
Hello, everybody, and welcome to the Myo360 podcast, where we focus on holistic solutions for snoring, TMJ, better breathing, and better sleep. I am your host, Becca Rose, from Myofunctional Pathways. So today I would like to talk a bit about probably the top 4 reasons why my clients seek myofunctional therapy and why they find us. Okay. So number 1 is that they suspect or they know that they have a tongue tie. Number 2, they are snoring or have sleep apnea. Number 3, clenching and grinding the teeth. And number 4, having trouble breathing through the nose, leading to chronic mouth breathing. So those are the top 4 reasons that my patients usually reach out to me. There's others, but we'll get to that in another episode. So if you are experiencing sleep troubles or clenching and grinding of your teeth, are you having trouble breathing through your nose? You suspect you have restricted tongue movement, I want you to stay tuned and we're going to dive in. Okay. So first, let's talk about the tongue tie. When you think of the word tongue tie, what is the first thing that comes to mind? If you're like most of us, we think of a infant, a baby with that really tight little string of tissue right on the tip of their tongue. That is the most understood type of tongue tie, the most common. But there's also another kind of tongue tie that most people aren't aware of, and that's where a lot of us fall into a category of restriction, tongue restriction that we didn't know we had, including myself. So in order to have full functional use of our tongue for chewing, swallowing, breathing, sleeping, snoring, we have to make sure that the back and the middle part of the tongue are not restricted or tied down in any kind of way. A lot of times when people come to see me, they're like, hey, you're the first one who's ever told me I have a tongue tie. And sometimes it's confusing to them because, again, we think of that baby with the little string on the tip of the tongue, and they don't have that. So they don't realize they have a tongue tie. And then clients come and they're like, I am upset that no one has ever told me this before. Why hasn't my doctor told me this? Why hasn't my dentist told me this? It's no one's fault. It's just if you're not trained in tongue ties, the posterior tongue ties, then you're not going to really know what you're looking for. And the doctor's not going to know either if they are not trained to assess that kind of tongue tie. So when we assess a tongue tie, we are looking at function and appearance. Appearance is a small part of it, but mostly it's about what are your functions like and what are your symptoms like. Once we do the evaluation and I point out all the different things that I find during that evaluation, the client usually has this big aha moment, because all of the things that they realize they've been struggling with for so long are finally making sense. And maybe they've tried lots and lots of different things and haven't had any success. So myofunctional therapy is really important to prepare the tongue for the tongue tie release, because after the release and after the healing process, you're going to have much more range of motion of your tongue. And we want to make sure that those muscles already have strength and coordination and endurance and range of motion, all these things in the tongue to help keep your tongue out of the airway. And we'll talk about this a little bit more in a future episode. All right, number 2 reason why people come to see us: they have sleep issues, snoring, sleep apnea, all of the above. So, myofunctional therapy has been proven to improve sleep health and snoring. And there's a very well known study out there by Dr. Sarush Zagi. He's out in LA and he's an ENT. And his study has concluded that myofunctional therapy alone can reduce the severity of sleep apnea by 50% in adults and 62% in children. That's a pretty big number. Okay. If you can reduce your sleep apnea and your snoring by 50% as an adult, that's huge. That could be the difference between having mild sleep apnea that you can maybe reverse or having severe apnea where you need to depend on a CPAP machine in the future. That's a huge, huge thing. And why does that work? Well, in myofunctional therapy, we are actually strengthening all the muscles of your upper airway, your mouth, your tongue, the back of your throat, your soft palate, your facial muscles. All of these muscles are responsible for keeping your airway open and strong. The best way I like to describe it is, so if you're breathing real heavily at night and you're snoring, or you have sleep apnea, think about if you have a plastic water bottle and you're drinking out of the water bottle and you drink all the water out, but you keep sucking on the bottle, you suck all the air out. And what happens when you suck all the air out? The bottle, it collapses in on itself. That's essentially what's happening when we have too much breathing, heavy breathing, and weak muscles in our airway that helps to contribute to snoring. Now, there's lots of other reasons too that can lead to snoring and sleep apnea, but it's pretty basic physiology that if we can keep the airway muscle strong, they are much less likely to collapse and obstruct your breathing. The other part of that is training the tongue where it should be in the mouth at all times. Breathing is a big part of that as well, because a lot of us breathe too much. We breathe in physiologically, we breathe more air than our body needs. Just like we eat more calories than our body needs, we actually breathe more air than our body needs. And that's kind of weird to say, right? Because, like, all right, how can you get too much air for real? How does that happen? But it's all based on science and biochemistry. And breathing is a really big component to sleep health. So, the type of breathing that we teach here is called Buteyko breathing, and it's a form of functional breathing. And it uses the biochemical part of breathing that a lot of other breathing techniques don't teach. So we want your body to work for you all the time. It's not about taking big, humongous breaths in and breathing out through your mouth. It's about optimizing your breathing gases, your oxygen, your CO2, and a sneaky little gas called nitric oxide that not a lot of people know about. We want to utilize all of those gases to get improved blood flow, dilate, open up your blood vessels, and get more oxygen delivery to your whole entire body, especially your brain. How you learn to breathe during the day then translates into nighttime. And when you have better breathing at night and you're breathing in adequately instead of over breathing, you're more likely to reduce snoring episodes and frequency as well. All these things lead to a much more productive and restful night of sleep. Okay, number 3, clenching, grinding, TMJ discomfort, facial pain. Number 3, this is why our patients come to see us. So there are 4 groups of muscles that help to support your jaw joint. There's this big muscle up here. It's called the temporalis muscle. It starts on the side of your head. Our masseter muscle, which is one of our big chewing muscles in our cheek. And then deeper inside the mouth, it kind of hooks up and around and under. There's 2 muscles called the medial and lateral pterygoid muscles. I know most people don't care about those, but I want you to know what they're called. Most often, TMJ. So what does that stand for? Temporal mandibular joint. A lot of times we clench or we overgeneralize the term TMJ, and people say, "Oh, I've got TMJ problems," or "My TMJ," or "I have face pain because of my TMJ." TMJ is the actual abbreviation for the joint itself, the temporal mandibular joint. But a lot of times that's how people associate that. They just say, oh, TMJ, and everyone knows what they mean. But really, the correct way to say it is if you're having problems with clenching and grinding and facial pain and TMJ pain, we like to call it a TMD, which is a temporal mandibular disorder. Okay. Because there's lots of different reasons for that. But usually the muscle support that surrounds the joint is not ideal. And these muscles maybe aren't strong and coordinated and toned because maybe your body has never learned how to chew correctly. Maybe your mouth has been open your whole life. When the mouth is hanging open, that elongates the jaw. It elongates the muscles in the head that help to keep that jaw closed. So there's a lot of reasons why we could have TMDs. If there was an actual joint problem, like there was something wrong with the bone itself, most people would know about this already. Those type of situations tend to be seen more commonly in people that get like a locked jaw. So if you were to open up and take a huge bite of a sandwich and your jaw would literally lock open or lock closed, those are more likely to be actual issues with the joint or the bone itself. All right. Other things like the clenching and the grinding, those are muscular reactions to a poor airway. So if the tongue is falling in, the jaw has to clench to open up the airway, to move the jaw forward so that the airway space in our neck can open up. A lot of times this happens in kids. So if you're having a child that is grinding their teeth all night and they're restless and they're all over the place, their bed's a mess, they woke up on the wrong side of the bed, literally and figuratively, then there's a very high suspicion of some sort of airway dysfunction or breathing dysfunction happening at nighttime while they're sleeping. And so I'm getting off topic a little bit here, but you have to think about the joint as not just the joint, okay? When we think of TMJ or TMDs, we don't really think about the muscles. We don't realize how much support is there. Think about your knee, your elbow, your shoulder. Think about those joints for a minute. If you were having trouble with one of those joints, more than likely your doctor would order you to maybe have an image and maybe go see a physical therapist. And what is the physical therapist doing? They are not making your bone better. They are making the muscles better. You are training the muscles to support the joint. And we are doing exactly the same thing with the muscles that support the TM joint, the TMJ. All right. Once you can get some muscular stabilization, pretty quickly, patients realize they feel the improvements of strong support. Like, wow, I did not know that this was such an issue. And that's really the greatest part about when I'm working with the TMD clients is how much better they feel so quickly when we can start getting some strength to their joints. And then we teach the other muscles to do the jobs they're supposed to do so that we don't overstress the muscles that support the joint. It's all connected. Our whole entire face and mouth and neck, it's all connected. Okay. So if we're working on one muscle that's not directly involved with your TMJ function, it's going to improve your TMJ because, again, we're taking the compensation away from the muscles around your joints that are overcompensating. They're doing too much work. And maybe your body is asking them to do a job that they don't normally do. And over time, over months and years, excuse me, that starts to break things down and leads to that pain and discomfort and facial strain that a lot of us deal with. Okay. Number 4, the fourth reason, biggest reason why people come to see us here at Myofunctional Pathways is that they have chronic nasal congestion and open mouth breathing. We all know what an open mouth breather looks like. Think of Napoleon Dynamite, that mouth, the lips are kind of, the chin is hanging down, the mouth is long, the whole facial structure starts to grow. long in a vertical way. If your mouth is open all the time and you can't breathe through your nose, there's not a lot of things out there that are going to help you. What we do during a myofunctional therapy evaluation is we do some different little tests and techniques to see, okay, do we suspect that there's a structural problem here? And what I mean by structural problem is, are the bones in your nose, the turbinates, are they really enlarged? Now, I can't see that without an image, but the testing kind of gives us an idea of, all right, is this a habit? Is your mouth breathing become a habit because you've been doing it your whole life? Or is there a structure problem? So if you can't do certain things, then we might suspect large nasal turbinates. In a child, maybe the adenoids right behind the nose are very enlarged, or the tonsils are very enlarged. What's the shape of the roof of the mouth look like? Where does the tongue rest in the mouth? All these things help us to try to figure out, is this an issue that needs to be addressed by an ENT or an airway doctor? Or can we progress with myofunctional therapy and start learning how to implement our nose? The nose is a really tricky organ because it's like use it or lose it. The less you use it, the less it's going to work. And it does take a little bit of time and practice to get it up and going again. So, but we have a lot of success with that as long as it's not, the nasal obstructions are not due to, bones or tonsils or adenoids or something else like in the actual airway space. Yeah. So we don't realize too how much the shape of the roof of the mouth plays in your ability to breathe through your nose, because the roof of the mouth, so your hard palate, it's the roof of the mouth, but it's also the floor of the nose. So if your mouth is growing very tall and pointed up, it's going to push on the nose bone, the septum, and that can sometimes create a deviated septum. And this was actually the case with my own 6-year-old child a year and a half ago when he was 6. We had an image taken called a CBCT scan at an airway dentist office. And that image was able to show us the turbinates in his nose, the adenoids behind the nose, the tonsils, and what the actual airway volume space is, amongst and other things, where the tongue was in the mouth, what the shape of the palate looks like. So much information on that image. It was really helpful. In my case, my 6-year-old, he has never had an accident. He's never had a huge blow to his face, but he had a deviated septum. And I know already from having a dental background that his upper jaw, his upper palate is very, very high, pointy, tented, it's vaulted. And that is likely the cause of his deviated septum because that bone pushes up, it grows up, and then it pushes on that bone continuously 24/7 days a week. It's constantly pushing on that bone. And when kids are young and bones aren't completely solidified yet, there's more likely for there to be a kink. In his case, he could not breathe through his nose. And as a myofunctional therapist and his mama, it killed me that there was nothing I could do to help him because the structural issues were preventing everything from him being able to breathe through his nose. So my poor little dude at age 6, we had to reduce the ENT, reduce the size of his turbinates inside his nose, took out his adenoids, took out his tonsils. After he was all healed up and he was comfortable again, he was able to breathe through his nose. But here we are now, a year and a half later, and we just took a new CBCT scan because we are going to start expansion for him so we can grow that really high jaw outwards this way, horizontally and transversely instead of up because his face is too narrow and he doesn't have enough room for his teeth. So we are starting an expansion process and we had to take a new image to be able to get that process started. And guess what? His adenoids are enlarging again. And my jaw dropped. But I'm also not surprised because when we are mouth breathing all the time, that creates inflammation in those adenoids and then they can grow back or enlarge again. As we become adults, the adenoids shrink away. So we don't have those for our whole life. But when a child is developing and they're in the way, and they're affecting how they sleep, how they breathe, how the oxygen is getting to their brain, that plays a huge impact on a child's development. Okay. So the reason, even though we took care of the turbinates, we took care of the adenoids, we took care of the tonsils, my little dude still cannot keep his mouth closed very easily because his jaw is so tall that his lips had to work so hard to come down around and try to close around a really tall face. And that is the problem. So removing the tonsils, the adenoids, the turbinates sometimes has to be the first step in order for there to even be the possibility to breathe through the nose. But if the upper jaw structure is also a hindrance to that, then we need to also look at that, because now I can do as much myofunctional therapy as I want with my son. He's eventually going to need a tongue tie release as well. But if we don't help the shape of his face grow in an ideal way, he's still going to struggle. His mouth is going to probably hang open for his entire life. So myofunctional therapy, there's a lot of pieces. I do the actual muscle therapy part of it, but then we work with multiple different providers, multidisciplinary teams to get you the best results for long-term success. Okay. And sometimes this is overwhelming. When we meet for the first time, it's like, oh my gosh, what am I going to do? There's so many things. There's so many options. It's overwhelming. We take one step at a time, and I always work with you at your pace. So don't ever worry about there's too much to do. We'll get it done in the order that it should happen to get you the best long-term results. And that's what it's all about. So those are my top 4 reasons that my clients come to see me. We've got the suspicion of the tongue tie. We've got sleeping problems, snoring, sleep apnea. We've got TMJ and clenching, or we've got mouth breathing, or a combination of all of them. Often people have more than one of those, but those are the main reasons our clients contact us. In future episodes, I'm going to dive deeper into each one of those categories and give you a bit of background and understanding of, wait, how did this even happen in the first place? How did I end up like this? And we'll deep dive, we'll dissect those things a little bit more so that you can understand better what's happening and how these things affect your life, affect your symptoms, your allergies, your sleep, your attention, all kinds of stuff. So thanks for tuning in today. We will see you again on our next episode. And we are inviting you to visit our website at myofunctionalpathways.com, where you can schedule your discovery call to find out, do I need myofunctional therapies? It's a free call. Visit our website. You can schedule that anytime. We look forward to talking to you again. Have a great one.
Now for the fine print. The information presented in this podcast is for educational purposes only and should not be taken as medical advice. We recommend consulting with a qualified healthcare professional for any questions or concerns you may have regarding your specific health condition.